As the country continues to battle the deadly enemy, many people are taking precautions while the experts also work day and night in hope of finding a vaccine or a cure to the rising epidemic. And as the numbers are rapidly increasing here in Kenya, the health sector is getting ready for tough times to come as transmissions are now communal based. Plans are also on the way to ensure that the healthcare workers who are at the forefront putting their lives at risk to help fight the virus are taken care of to prevent contact from infected patients. A collaboration between the Health Ministry, AMREF and Rockefeller Foundation have established a center with a 100-bed capacity set up in order to offer both basic and critical care services for healthcare workers with all costs met by the government.
The first step we've made is that every patient who comes in first has to go through the hand washing or hand sanitizing. Then you're screened. You ask question depending with the history of your travel. Then another thing is to educate the health workers on how contagious the COVID-19 thing is. Yeah, so I believe they're well prepared in case of a case. We have personal protective equipment, to be precise, and we have also a toll-free line to call in case you suspect a case. Testing kits have not yet been availed.
With malaria and typhoid being factors that could raise one's temperature, and also the fact that the first basic trigger for COVID-19 is increase in temperature, many have questioned why testing for temperature should place one as a COVID-19 patient if his or her temperature is way above the norm.
When one presents having the same symptoms, headache, fever and body pains, you are advised first to be screened, that is the temperature, and the temperature above 37.5 warrants a series of blood tests so as to rule out other infections. But we advise patients, mostly those who have symptoms like flu, to go to the nearest county referral hospitals just to have a series of tests to rule out other conditions.
Na kuzingatia tu masharti ambayo serikali imeweka, kujitenga na watu na kumaintain usafi na kuvaa barakoa.
There are isolation centers and quarantine centers put in place, and there is also a spraying going on at the border points. So I believe Busia County is well prepared. So yeah, the lockdown is a way of preventing cases from rising, but it doesn't necessarily guarantee 100%.
Yeah, serikali inajaribu, but not that much. It is trying to some extent, but not fully. We are not satisfied with all the things they are doing.
As this deadly disease does not have a cure nor a vaccine, people ought to take care of themselves in order to prevent further spread. The virus spreads mainly from person to person, especially between people who are within 6 feet in close contact, and also through respiratory droplets produced when an infected person coughs or sneezes. We should ensure that we take precaution like washing our hands with soap and water regularly, and in absence of water, one should use a hand sanitizer. One should also avoid touching their eyes, nose and mouth with unclean hands, and beware of infected persons so as not to get infected. The infected people should also stay at home and seek medical checkup so as to avoid spreading the disease.
After you've identified a patient has a fever of 37.5, you do a series of tests to rule out other factors. Now, if malaria is there, after you've administered your dose, the full dose, it's still persistent. Now, these warrants other tests. That's where now the COVID-19 test comes in. Yeah.
With Kenyans desperate to go back to normalcy, lockdown measures being implemented in other counties like Nairobi and Mombasa, curfew measures have been followed to the latter. But as many would ask, is it a guarantee to stop spread of COVID-19?
You're preventing the droplets from entering your body through main ways, either the nose or the mouth. So when you have a standard mask, that is standard surgical mask, or there are some clothes that are not surgical masks, but those are WHO proven. Yeah, so once it prevents the body openings like mouth and nose, it helps.